Policy Innovation Seminar Series. My name is John Canavan. I'm the Director of the UNESCO Child and Family Research Centre here in the Institute for Life Course and Society at the University of Galway. And I'm the MC for today's seminar. The event itself, well, I'm really excited about it because it focuses on this really increasingly important topic for the university and policy communities that have research impact. For people like myself, there's no clearer demonstration of the significance of impact than that its inclusion as a component of formal processes that assess the quality and value of our research outputs from our schools and disciplines. And for some of us, that's easy. It aligns with what we do. It's our subject area, and it's to do with our motivations to be involved in academic life. But for others, it's outside their experience, and it's outside their initial expectations of the academic role. For policymakers, we know that they need rigorously designed and delivered valid, reliable research as a key ingredient for their work in policy formulation all the way through to policy evaluation. And we can say safely that is particularly so now in our social media AI age, where the idea that we have organizational roles concerned with disinformation really tells its own story. So today, our particular contribution is to focus on the practice of research impact, how we get it done, and what are the how-tos and the barriers to this. This particular seminar builds on ongoing work led by the Office for the Vice President for Research and Innovation here at the University of Galway. And our format today is to start with 4 excellent examples from the work of University of Galway academics of their experiences. The presentations they make are intentionally brief, both to give a variety of experiences, but also to model what we know helps busy policymakers, that of summary, brief, etc., presentations of important research. The next part of the seminar, the webinar, involves presentations and engagement and responses from 2 highly experienced senior civil servants. Colleagues who have held roles in research commissioning and utilisation, and who are currently at the forefront of this area of research impact and bringing the work of the higher education institutions and policy, public policy, to closer dialogue, which is what we're about today. So after the responses from our senior colleagues, we will have plenty of time for a facilitated discussion, and we will go until 2 p.m., all going well. Now, because we've quite a few speakers today, the simplest thing is to introduce everybody now and just to say a little bit about everybody. So what I'm going to do is to present and talk about everybody in order of their appearance on the agenda. So starting with Dr. Charlotte Silk. Charlotte is a researcher at the UNESCO Child and Family Research Centre here in the Institute. She's involved in ongoing research relating to youth, their social and emotional development. And really, her involvement in this work brings her into close contact with policymakers, practitioners on an ongoing basis. Professor Colette Kelly is Professor of Health Promotion in the School of Health Sciences. And previously, she was the director of the Health Promotion Research Centre at the University of Galway. Colette is co-principal investigator of the Health Behaviour in School-Aged Children, the HBSC study, which a lot of you will be familiar with, which is undertaken on behalf of the World Health Organization, and again, with a strong policy commitment in that work. Siobhan O'Higgins, Dr. Siobhan O'Higgins works in the School of Psychology at the university. She's at the forefront on work to promote sexual health and research relating to that. And she is one of the active consent leads, a national programme which really seeks to raise awareness and help to positively influence behaviour in relation to sexual consent. And this is an area in which the University of Galway is a strong leader nationally and internationally. Our final speaker from the university is Dr. Nata Duveri. Anata is a colleague of mine in the School of Political Science and Sociology. She's a development expert, and she's done significant work on the economic costs of gender-based violence. She currently has a role as co-chair of the Economics Working Group for the Lancet Commission on Gender-Based Violence and Maltreatment of Young People. So that's the University of Galway colleagues. So then our policy expert respondents. So starting with Mary. Mary Doyle has served on the management board of the Department of Taoiseach, Health and Children and Education and Skills. Latterly, she was involved in the higher and further education policy and funding. Mary is retired but has taken on a role of visiting fellow in public policy at Trinity College. She is a member of the RIA, and her work particularly focuses on this connection between the HEIs and public policy making. Fergal Lynch now works at the University of Galway, and his role is very particularly focused on developing closer links between researchers and policymakers. Fergal was previously Secretary General in the Department of Children, Equality, Disability, Integration and Youth, and formerly held a role of Deputy Secretary General in the Department of Health. So our final kind of leader, if you want, within this afternoon's work is Professor Caroline McGregor. Caroline is a colleague of mine in the School of Political Science and Sociology and in the centre here. She's a senior research fellow in the centre. And Caroline has done significant work on the interdisciplinary dimension of research impact, working closely along with Dr. Brendan Dolan on work with Quorum here in the last 4 or 5 years. And Caroline is going to be our moderator for the Q&A. So just to say a couple of quick thank yous on my own and Fergal's behalf to our presenters today, to Deirdre Conway and Gillian Brown in terms of organising the event, support obviously from the interim ILAS director, Kieran Walsh, and from colleagues in the Office of the Vice President for Research and Innovation, everybody who made a significant contribution in making the event happen today. I suppose in terms of the event itself, however, really the event will function and will be most useful if we get engagement from yourselves, the audience. And what we are hoping is that we will have lots of contribution using the Q&A function on Zoom to post a question or comment. And Caroline, Professor McGregor, will moderate and lead us in what should be a very useful discussion. And the idea of today, it is avowedly a dialogue, so we really do want to get a conversation going. So that leads me now to start the event by asking my colleague in the centre here, Charlotte, to take the floor. So just over to you, Charlotte.
Thanks, John. And hello, everyone. I hope you can all see my slides okay now. So the case study I'm going to be discussing today centers on the development and implementation of the Activating Social Empathy program. And this is actually a project that we started a number of years ago. And our approach was very much informed by the research and policy context at the time. So just to summarize this a little bit for you, when we first started this project and we started looking at the research context, a couple of things stood out to us. So one was that we found that there was a large volume of research which indicated that empathy was associated with positive youth outcomes across a variety of different domains. And two, that there was also a large amount of research which indicated that despite these potential benefits, empathy-related values and competencies appeared to be declining, particularly among younger generations. And so this is something that we wanted to address. And again, when we looked at the research base, we found that a substantial amount of evidence indicated that young people's ability and willingness to engage in empathy appeared to be influenced by their social context, and that empathy is a skill that can be taught and strengthened over time. And in particular, schools were frequently being identified or cited as important contexts or settings for teaching social and emotional learning skills like empathy. And similarly, then, when we looked at the wider policy context in Ireland, we found that a number of key policy documents like Better Outcomes, Brighter Futures, the Action Plan for Education, the Action Plan for Bullying, or the Wellbeing Policy Statement and Framework for Practice, they all outlined and addressed the importance of promoting social and emotional competencies among young people. But I think what was interesting from our perspective was that when we looked at how SEL skills, so social and emotional learning skills, how they were promoted or actualized within the education curriculum, we found that post-primary schools tended to focus more on the teaching of what we call self-oriented SEL skills. So these are things like mindfulness, emotion regulation, resiliency, and they tended to focus less on the teaching and promotion of other oriented skills like empathy. And so this was really the impetus for the Activating Social Empathy program. However, I think it is also important to acknowledge that the policy context has evolved and changed over time. And in particular, it should be noted that in 2023, the National Council for Curriculum Assessment updated their SPHE framework. And following a public consultation, they decided to include empathy as a key standalone outcome, learning outcome for all junior cycle students. And it was during this respecification process that the NCCA approached our research team about potentially including the ASE program as a recommended teaching resource within this new SPHE toolkit. And I think maybe one of the reasons why our team was approached or invited to contribute to the toolkit, and this is just my own personal opinion, but I think one of the reasons was in part due to the media work and campaigning that the team had engaged in over the years around the importance of empathy education. And in particular, I'm thinking of the work of my colleague, Professor Pat Dolan, in this regard. And I think for me, this really just brought home the importance of communicating findings and ideas to the public and to policymakers and engaging with the media, just even in terms of creating awareness of a topic, but also showcasing your own knowledge and expertise within a particular subject area. More generally then, I think this process was also a good learning opportunity for us and helped us gain greater insight into the intricacies that are involved in connecting a program or linking a program with a specific policy document or curriculum framework. And I really emphasize the importance of things like ensuring that the program is accessible and attractive for educators, that it's compatible with the wider policy framework, but that it's also targeted in its objectives. And this was a really important learning, I think, for us. So for example, we found that to be included in something like the SPHE toolkit, it was important to ensure that each session or program lesson within the ASE resource explicitly addressed a specific learning outcome within the SPHE framework. And the feedback we received from the NCCA in this regard was that less is more, that they felt it was better to ensure that the program tackled one or two learning outcomes well, rather than us trying to link the program to multiple different learning outcomes within the SPHE framework, particularly if some of those things may be a little bit more tenuous. And I suppose overall then, I do want to acknowledge that while having the ASE program included in the toolkit is something that we regard as a major achievement and something we're very grateful for as a research team, I think maybe one potential limitation or trade-off to this process meant that we would have less control over how the program is implemented in schools, and we would also have less access to monitoring data. So because teachers and educators can access the program directly through the SPHE toolkit, it meant that we no longer had information about which schools were accessing the program or how they were implementing the program. And this maybe makes it a little bit more difficult for us to further evaluate the effectiveness of the program or make recommended changes or modifications over time. And so I suppose just to wrap up then by maybe reflecting on some key learning or insights from the overall project or process, I think one thing that I've become more aware of personally from this process is that any policy or curriculum change or new program has the potential to be contentious. And so I think having a strong rationale or evidence base that supports these changes or supports these programs is really important. And I think both from a researcher and a policymaker perspective. I think another important lesson we learned was that how teachers engage with the program when it's part of a wider research evaluation or a one-off research study in terms of their interest in the program, how they implement the program, or their fidelity to the program might be very different to how they engage with the program when it's not part of a research context and it's just part of their everyday teaching. And so this, again, really emphasize the importance of co-designing and engaging and collaborating with teachers, students, and other stakeholders early in the process to ensure that the programs are not just designed to be effective, but that they're designed to be attractive and useful for educators when they're dealing with other issues like time constraints or competing demands, just in terms of trying to create a program that has sustained engagement over time from teachers and is more likely to be have high levels of fidelity. And finally, and I think this is maybe an observation more than anything else, but for me, I think sometimes there can be a disconnect between certain policies and practices. So for example, although empathy is recognized as a key social emotional competency and it's now included as a mandatory learning outcome for students, empathy and social emotional skills training are not a compulsory part of teacher training or teacher education programs. So for me, I think this just raises a bigger question about when we make changes, when we make policy changes to things like student education curriculum, how can we best support educators to enact this policy and promote these outcomes in a meaningful and standardized way? So thank you, that's it from me, and I will now hand over to Professor Colette Kelly.
Thank you, Charlotte. I'll just share my screen. See. More than I can't see it myself. Okay. Can I make this a little bit bigger for myself? Sorry. For some reason it's not coming up on my screen. I have it on another one here. I might have to look over this way if that's okay. Yeah, can everybody see if I just put it on full screen here? There we go. Can everyone see that? Okay, great, thank you. Sorry about that. So the case study I'm going to talk about today is the health behavior in school-age children study. And so some of you may be familiar with it, but if not, really, the study is so a brief overview. It's a cross-national research study conducted in collaboration with the World Health Organization. And there are 51 countries and or regions involved, and we've got about 400 researchers across the network in those 51 countries and regions. So it started in, well, the HBSC study started in 1982, and Ireland collected their first round of data collection in 1998. And there we go. Yeah, so the overall, and I suppose data is collected every 4 years. And we've done 7 rounds of data collection thus far. So the overall aim of the study is to gain insight into and increase our understanding about young people's health, their health behaviours, and the social context of health. So similar to that, I suppose, simple figure that's on the slide there. And I suppose as a team, we aim to improve the lives of children from the work that we do. And we do this by collecting, analysing and disseminating our findings about children and adolescent health. And we do this by disseminating it to policymakers, of course, but also to community groups, to schools, to NGOs, and to the public. So I think this sort of reiterates the point that Charlotte was making, that there are so many routes to which you can influence policy, and it's not directly us working just with policymakers. We have to get messages out there to the general public, to communities, to schools, to parents as well, because they can also advocate for change and influence policy making and policy decisions. Excuse me. And really, I think our work has been influencing policy probably since the beginning. And the reason was the policy issue way back in 1998 was that there wasn't data on children's lives. So HBSE has been able to inform that, feed that data to policymakers. And what's also important, I suppose, is yes, we collect this data every 4 years, but as we know, children's lives are changing, their worlds are changing, the social context in which they're living changes. And so it's important that we can continue to collect this data and respond to those changes in children's lives. So how have we impacted on policy making? Well, I think we've had this, what I'd call maybe a reciprocal relationship. So we use a mandatory, we use a protocol, I suppose, to collect the data and to develop the questionnaire. And each country has what we call mandatory questions that everybody asks. But we have flexibility to include questions that are national, of relevance to a national team, so of relevance to Ireland. So we invite public health, voluntary, obviously policymakers, the community sector, and young people themselves to inform our work. So it's kind of coming back to this co-design as well that Charlotte mentioned. So they can tell us what's important, you know, what's of interest to them now, what has changed, where are there gaps in the data, and we can include questions on that in the HBSC survey. Excuse me. So, and similar to that, the reciprocal relationship piece is that we also have a knowledge or research translation help desk. So people can come to us to say, can you analyze the data on X or Y? I'm interested in, you know, sweet consumption, or I'm interested in family communication, and send us a short report. And so that's some of the work that we also do as part of our project. And those reports then are made available to everyone. So that reciprocal relationship, I think, has helped us to ultimately impact policy making. So going back to the co-design of research, I think there was like a turning point maybe in some of our work when we had what we call, I suppose, a flagship partnership with the Department of Children, Equality, Disability, Integration and Youth, or at the time, Children and Youth Affairs. And we worked together with them and the Citizen Participation Unit and over, 400 children to reformulate, I suppose, and redesign the HBSC questionnaire. And young people basically told us what was important to their lives, and they developed the questions themselves. Ultimately, what happened is some of these questions or indicators are now used in the State of the Nation's children's reports. They've also used with the Better Outcomes, Brighter Futures framework, and now the revised framework for young people called Young Ireland. So I think this is a nice example of, having young people involved all the way through to policymakers choosing some of these items because of their significance. A few maybe examples of where we've also influenced policy is a number of years ago, we included questions on smoking in cars. And ultimately, this was part of the reason, or has at least led to advocacy and then ultimately legislation around banning of smoking in cars where there was someone under 18. We also collect data on vaping as another obviously quite topical issue. So we first collected data on vaping in 2018, and we have collected it again in 2022. We're actually launching our national report on HBSC next month on April the 10th. So we will have this data available to policymakers, and everybody is asking us for it, but we have to wait for the official launch. But that vaping data will also be important to look at other things that government need to do in terms of restricting the sale of vapes, looking at price, looking at promotion and marketing of these to young people as well. Another example maybe of some of our working with policy or influencing policy was I suppose, I guess it was, we were approached by the Institute of Public Health looking for, really there was a gap in data around sun safety behaviours. So things like use of sunscreen by young people, wearing hats, even sunbed use. And so together with them, we developed some items, we piloted those questions, and that data was collected in 2018 and again in 2022. And that has informed the work of the skin cancer prevention programme, and initiatives, have been rolled out since then to the public around safety around the sun, etc. Another item maybe just briefly is period poverty, which people may not be as familiar with, but it's that inability to afford period products. It's quite topical at the moment, and this will be our first time collecting data on that in 2022, but will be of significance to certainly to the government, the development of obviously the child poverty unit, and feeding into that and some of their work around the provision of period products in various different institutions as well. So in terms of reflections, maybe similar to what Charlotte said, I suppose, we have high quality cross-national comparable data. So the high quality is key. So following the science, I guess, that's really important, that we are confident in our data, having this open communication with policymakers, but also advocacy partners and all of the knowledge users involved. So whether for us, schools, communities, parents, the media, that has been certainly influential in our relationships then with making, policy making. I think things like leadership and leverage. So I chair the youth engagement group across the international HBSC network, and Saoirse McGowan, who's the co-principal investigator on this study, co-chairs the policy development group. So I guess demonstrating leadership, which takes time, I guess, and that's another thing, our work has evolved over time, and there over time has helped us to influence policy making. Similarly, the Health Promotion Research Centre is a World Health Organization collaborating centre, and we have a number of different work plans. And I guess we've used these work plans to help us, I suppose, steer and work towards improving adolescent health and getting that on the agenda and on the agenda of policymakers. Other things like developing modules on knowledge translation, building competency in knowledge translation is also very important. I think being responsive and dynamic, so responding to things like consultation from policymakers, or indeed obviously short reports that they might ask us, but also producing things like policy briefs for them. Some of the challenges, I guess, this is, it's a difficult one because there are policy urgent matters which have maybe come to us or to others here. But we need to ensure that whatever findings we're giving to policymakers, that they're accurate, they're sound, they're based on good analysis, and that can take time. So that is a challenge certainly for us, that we need to make sure that we can go through our analysis and our quality checks and be confident in what we give policymakers. So I think that can be a challenge. And it is also a challenge to measure impact on policy. It's difficult to say that just our study influenced policy making. So that's something that we, I guess, find difficult, and often, I think other researchers also find that as well. So maybe three, I suppose, key messages maybe from our work is kind of making it count. So we all know, peer-reviewed journal articles are excellent, but they take a lot of time. So getting your information and findings out there in other ways is also important, so the policymakers can use it. So whether that's bulletins or fact sheets or short reports. Sharing it, so access to the data obviously has been influential over the years, that people can access our data. But what we've also found that actually our knowledge translation help desk has really helped, because we analyze the data then for them. As Charlotte said, engaging with the media, getting your message out there about various different topics and issues certainly influences policy making. And then making it easier, and this is where I think John made that point, that policymakers, yes, they might be interested in the statistics and the figures, but what can they say and what can they not say? These are the kind of the key messages that they need, and to be able to give that to policymakers and make it easier to use your data or your findings or your study, certainly I feel has helped us to impact policy. So whether that's data visuals or using data apps as well, they're just other ideas that we believe has made it easier to use our data. So that is it, just to say thank you. And I'd like to pass over to Dr. Siobhan O'Higgins. Thanks, everyone.
Great, thanks, Colette. Thanks, Colette. Oh, of course, I've lost my screen. Here we go. Technical issues as always. That's me. Where is my thing? Sorry about this, people. Oh no, I've lost it. No, I can't find my screen. I can't find my screen to share. How awful. Where is it gone?
Siobhan, would you want to take a minute? Nata, would you be happy to do your presentation now and maybe hand over to Siobhan? Would that work?
Yeah, that's fine with me.
Thanks, Nata.
Nata.
You might let us know in the chat how you're getting on, Siobhan. Okay,
Yeah,
thanks.
sorry about this.
Okay.
Okay, I've got it now.
Can everyone see my screen?
So we can see all your background stuff. We can't see the actual, it's not a full screen slide, if you know what I mean, Nata.
Okay, let me see. Wait from start. No?
That's it. There we go.
Okay. All right. Thank you for the invitation to participate in this conference and discussion around policy relevant research. I'm delighted to participate and share with you my experience of doing a program of research that is focused on the cost of domestic violence, the cost of doing nothing. I'm presenting on the basis of a program of research that has been conducted in a variety of low and middle income countries for more than a decade. So starting from about 2012 to 2024, a range of studies have been conducted with the central vision of trying to ensure that domestic violence is seen as an economic issue, to in fact change the narrative and broaden the focus of the discourse on domestic violence. And this involved actually really developing innovative methodologies to capture the economic impacts of violence against women, as well as economic methodologies to capture the multiplier effects of violence as it ripples across economy and society, and to be also link violence to economic growth, because violence is not often considered as a factor in macroeconomic modeling. So what have been some of the findings that we had? We did demonstrate that domestic violence has significant costs. The first significant cost it has is that about the out-of-pocket expenditures that women incur. So in Vietnam, we showed that the out-of-pocket expenditures that incurred by survivors of violence was equivalent to 30% of a woman's monthly income. In Ghana, we were able to establish that violence actually imposes a premium on the growth of the economy, that in fact the economy has to grow much higher than the level at which it is growing to offset the loss due to violence. In Ireland, we showed that the cost of lifetime, the cost of violence over the lifetime was 56 billion euros, or about 2.7 billion euros per year. But more importantly, we showed that violence has a significant impact of driving women into poverty. So nearly 80% of the survivors that were interviewed were unemployed or insecure employment, depending on government transfers when they left the relationship. So at the outset, they were in employment. By the end of the violent relationship, they were in poverty. And in Ethiopia, we showed that women earned less money than who experienced violence earned less income than those who did not. And that the level of service provision that is provided by the government nowhere meets the full cost of doing nothing. So that the service provision allocation of resources was 1/3 of the overall cost of violence in Ethiopia. This data did have impacts across different countries. So in Egypt, what we saw was there was an introduction of an amendment to the Penal Code in February 22 to criminalize domestic violence. It took 2017, 2018 was the Egypt study, and it took 4 years to have the data actually percolate through the system and have an impact at a legislative level. In 2019, in South Sudan, the government committed to passing a new law on GBV. And now that law has been introduced and is awaiting final approval. And at the global level, there is now a UN-wide agenda on estimating resource requirements for quality service provision. So you can establish the cost of doing nothing, but then we need to establish what is the cost of doing something. And that something should be at the highest quality level. So now there is a UN-wide program trying to look at the resource requirements for quality service provision. So what are some of the reflections that we can take from our experience? The first is that having a clear message or a vision of what is the desired change at the outset itself. Policy change is driven both by creating evidence, but it is also by motivation of the researcher to understand what we think is a key problem and designing our research to try and address that problem. So there is a passionate commitment of the researcher, which is extremely important. And that goes a long way in creating policy change. The second is to ensure to identify the key stakeholders that influence change. In our case, it was actually working first with UN Women and UNFPA at the outset to create understanding among these agencies, the importance of the economic argument around domestic violence. And that once they were convinced, they played a big role in persuading national governments to take on this new agenda and to engage with the research to establish the cost of doing nothing. It's also not just governments, but engaging with activists and NGOs to ensure that the outputs of research would inform their advocacy. And designing the country studies to include active involvement of all stakeholders. We've seen across already the previous two presentations, the importance of engagement throughout the process of the research process. It's either co-designing questionnaires or co-designing the protocols or the research design, but to ensure that policymakers and stakeholders have an input into the research itself is a very, very important. And to establish robustness of the data that is collected, we also had a technical advisory group. So we had a steering group that was of stakeholders, but we had a technical advisory group that was of academics, etc., to ensure the validity of the research process. And as both Charlotte and have already highlighted, ensuring that the message is repeated in multiple fora. There is the short reports, the media, etc. But it's also, even with government, it's engaging with all the relevant different government departments and taking your findings to the meetings within each of these government departments to create a continuous message that is repeated over and over again. And then that is what leads to some sort of effective policy change. So thank you. And I hand it back to Siobhan.
Thank you, Nessa. I am now going to share my screen. She says, oh, okay. Okay, you have to stop sharing, Nessa, and then I'll share mine. Oh, great. I'm not a technical person. Okay, thank you very much for that. Oh, there you go. This is us. We are an interdisciplinary team, and we have a new member now who is all about advocacy and activism. So we come from health promotion, psychology, theatre and drama studies, and nursing. Going forward. So it's a multidisciplinary approach because that allows us to explore how young people learn, but also how young people express and explore their sexuality going forward. So I'm going to be talking about the Active Consent Programme, which is about promoting consent literacy, which includes giving young people the confidence to actually communicate with their intimate partners, making sure that they know what to communicate and support each other and can challenge if they see negative experiences of others or amongst their own. So why do we do this? What do we know? So in terms of the research, Project McNeela, my co-lead, he started doing research with third level students back in 2014, looking at alcohol consumption. And then he found that one of the things that they were most worried about wasn't about the fact that they were getting very drunk, it was about the fact that they were having unconsensual intimate experiences. And so we've gone on from there, focusing then on how can we empower young people to have more positive intimate experiences if they ever choose to do so, and have less sexual violence and harassment happening for our young people. Because in the heel of the hunt, every parent wants their child eventually, when they're old enough, to have positive intimate experiences and make them grandparents. So everybody's on that vein of having positive experiences. So we found all this data that 78% of the students experience some form of sexual harassment. And encouragingly, now as things going forward, since we've been working in colleges, and then since working in colleges, we started working in schools, because the students said that they wished they'd had this information when they were younger. We found that everybody does agree that consent needs to be obtained before the start of any sexual activity going forward. So in terms of school data, this comes from a survey of school-age children to find, in fact, that there are issues around non-consensual sexual activity for our younger people coming forward. And we know from the Growing Up in Ireland survey that a third of 6-year pupils and a quarter of 6-year pupils and a third of, the other way around, a third of 6-year pupils and a quarter of 5th-year pupils will say that they are sexually active. So this is an issue for us going forward. So what have we done with all this data? We've worked with young people, we've co-designed interventions using the language that they find acceptable. So we work in higher education, we work in further education, we work with young people, we work with parents, we work with educators, we work with anybody who wants to work with us, which is basically has become an awful lot of people, because everybody wants to reduce the level of sexual violence and harassment going forward. So these are the things that we actually create in terms of workshops and training. So we train a lot of people to actually deliver our resources going forward. And in so doing, from the start of it, we now have in third level colleges, we have influence policies so that there is a consent framework. And now every third level college is actually employing sexual violence and harassment posts to actually coordinate all the policies within third level colleges going forward. And then in terms of working in schools, it was the third level students who said we needed to have this kind of information in schools. And so we work in schools, we train teachers to deliver our resources. And our resources include all sorts of different ways, a multifaceted approach to have these conversations. So it goes from a face-to-face workshop to a 30-minute induction. So in third level colleges last year, 23,359 first-year students engaged with a 30-minute resource, and 85% of the females, 76% of the males, and 76% of the other genders said that they'd learned something useful. So we've got a huge reach now, because people actually believe from the research that we need to do something positive to empower young people to create a consent culture rather than a rape culture going forward. So I thought, rather than talk about figures, because we could talk about figures all the time, it's important to see what the young people say themselves. So for a male student teacher, we realize, coming from exactly what Charlotte said, we need to train our teachers going forward so that they can actually engage with resources to give young people the skills that they need going forward. So it's more than just getting your leaving cert. It's more looking at social skills and how can you actually express, in terms of what the work we do, express and explore your sexuality in positive ways going forward. And also to know that you can say no if you don't want to do anything that you don't want to do, because the context in which young people now are exploring their sexuality is very different from the context in which we, or I, and many of the parents explored theirs. So it's about engaging with everyone. So we work with school-age children, we work with parents, we work with educators, we work in the third level colleges, training people to use our resources. So you can see from this, these sort of quotes that people find it very, very positive. We use humor, we use stories, we use the language that is appropriate for each cohort of young people going forward. And it is about giving people the skills to actually talk about these things. So that is why training is so important. It's about making the training available to everybody. So luckily for us, we get funding, so it allows us to train all sorts of people. We work with the rugby players, we work with all the Chugga centres, which are our young farmers. We work with all of the third level colleges and increasing number of schools going forward. We work with the NCCA to develop the new curriculum for the junior cycle. So we also are part of the toolkit talking about how you can actually include consent within the RSC part of the SPHE programme. So I really like this quote from a female pupil of no age, that all the boys seemed to think it was a really important thing, and they knew more than I expected. And it's about that. It's about having a conversation. It's about not alienating anybody going forward, and using stories, because that's a really good way to get points across going forward. So we also have a play which has just finished going on tour, and it goes on tour. We were working before COVID, we worked with third level institutions, brought the play to students. But what we found was, in fact, the engagement has been far greater when we've worked with school-age children. And it's a different way of getting the message across, because they watch 4 actors and 4 blocks of wood go through 11 different scenes going forward. And it's worked really well. And as even the parents saying a huge thank you, my daughter attended and loved the play. So we are making a difference. We've changed policy in terms of what's important in terms of the education for our school-age children, but also the supports that are being created for people going forward, and knowing about those supports and how you can support your friends and be an active bystander going forward. So we use all sorts we use animations, we use workshops, we use e-learning. We have a Sex on Our Screens, an e-learning resource for school-age children, so they can deconstruct what they're seeing in terms of on their phones, in terms of pornography going forward. And we evaluate everything that we do every summer and change things to fit the new context as things change, as the laws change going forward from that. And that's our website. We're very lucky to have funding to do all of this. And yeah, that's me.
Super. Thank you, Siobhan, and thanks to our presenters from the University of Galway. Really interesting. And just to reiterate the message on the chat, please do use the Q&A, because there's a lot of really interesting ideas there, I think, and a lot of different angles we can approach this important topic. At this point now, we will move on, and we're remarkably to time. We're about 2 minutes after what we said we would do, which isn't too bad. And I'm going to hand over to our policy practitioners, our policy experts, to give their reflections on these issues. And we're going to start with Mary Doyle. So over to you, Mary.
Thanks very much, John, and good afternoon, everybody. Delighted to be here. I wanted to thank ILAS and the University of Galway for arranging the webinar. I think it's very timely, and I was very happy when Fergal asked me to be involved. I was very happy to agree. Second thing I wanted to thank are the presenters. They're fascinating presentations, and I think they really do showcase how academic research findings can enrich our policy making process, and do that across a very wide and complex landscape. And I'll come back to that in the course of my remarks. So I've been asked to offer some reflections from my experience as a policymaker. And as John says, it's across 3 departments and a wide range of policy issues over time. So I propose to consider the issues at 3 levels: the national, the institutional, and then finally at the individual level. And I'll try to draw from my experience the things that I think are important and are relevant, and that can help us to develop this really, I think, essential agenda around evidence for policy. So at the national level, as John said in his intro, arguably the need for reliable research, evidence, synthesis, and thinking, which can inform public debate and policy development, has never been greater, particularly in the age of social media and fake news. So in 2021, I've been very interested in this issue for a very long time, stemming primarily, I think, from the time I spent on the National Statistics Board, but also my time on the National Economic and Social Council. So in addition to being involved in the, if you like, the political policy-making process, in my social partnership work also, I would have been involved with a whole range of stakeholders who inputted into policy. And I could see and strongly believe that there is an untapped resource in our higher education and research system, which could enrich and strengthen our policy development process. So in 2021, while I was in Trinity, I authored a paper which was entitled Research for Public Policy and Society, Building a Stronger Architecture for Ireland. And I suggested in this paper, and it's reflected a little bit in my remarks this afternoon, that in order for us to make progress nationally on this agenda, we needed to think about initiating, leading, and managing actions in three distinct spaces which are individual but which overlap. So in the research community itself, and I'm delighted to be talking to researchers today, and particularly in the higher education institutions. The second space that I think we need to pay a lot of attention to is in our institutions of democracy, specifically in the Oireachtas and in government departments. And the third space that I think we need to really look at is how the combined efforts of the research funders could yield us, I think, better results than those we have at the moment, which is not to be critical, but just to say I think there's a lot of potential in more joining up in terms of research funders. And then comes the easy bit, because all three then have to design an architecture which enables them to engage positively with each other into the future. Because I think the reality is at the moment, we're very much siloed, and you know, we struggle somewhat to make connections. And that's why I think this afternoon's webinar is so informative and so exciting. So of course, policymakers love systems. So how do we advance on this then, having set out that stall? So I was lead author in a Royal Irish Academy publication in later 2021. And the Academy has advocated a roadmap based on three developmental pathways. So the first pathway, and this is very, at one level, very, very commonsensical, but it's also quite subtle and needs a good bit of thinking. So the first pathway is, how do we build bridges, create trust, and offer opportunities between the policymaking and the research community? The second pathway then that we have to think about is how to join up and scale up what already exists. We've lots of stuff. It's all very good, but there is an issue of mass and scale, I think. That this is part of the agenda, I think, is one we haven't really tackled yet. But the third pathway, which is knowledge management and brokerage, which is at the heart of a lot of what we're talking about, is I think we're making quite a lot of progress on that. And Fergal and I, along with our colleague Sean O'Fallon, who's in Maynooth, and Kate Morris from Campus Engage, who's on this call, have been involved in supporting a number of knowledge brokerage sessions with the Department of Children and with the Health Research Board, with the EPA. And they've been very interesting and they've been very instructive. But we need to have a look and design a longer term set of arrangements to ensure that they're not one-off events and that there's some continuity, which enables us to take a national view of knowledge management and knowledge brokerage. So how are we going to do that? Well, I think there's hope. At the national level and led by the Department of Further and Higher Education, Research, Innovation and Science, Ireland is currently developing a framework of actions to support more aligned activity in the national research ecosystem. Work is underway across government to make its research needs more visible to a range of people, including yourselves, and particular to researchers in the higher education sector. And a cross-departmental research network has been established now, which is a really important innovation and should help make more visible the needs of the research, or the research needs of policymakers. And the next important milestone, I think, in this context is an evidence for policy framework is due to be published in 2024, and that will chart a course and provide greater connectivity between the key actors of government funders and the higher education sector and civil society, as been mentioned on quite a number of occasions this morning. So I think, you know, there's a lot going on at the national level. And that's just giving you some examples of what's happening. I haven't an awful lot to say about the higher education institutions, but I think they're really important, and I think reform is necessary in this context. Universities need to be much better at creating and maintaining their front of shop services so that policymakers can easily see what sorts of relevant expertise is available, both in individual institutions and across the system. And I think it's worth thinking about the future role of the research offices in this context, and whether they could help do some of the sort of the glue, the connecting work, and also the communication. So the last piece then I wanted to talk about is in relation to the individual researcher, just maybe some reflections again from my own perspective. So I would say that the first thing is that understanding the policy landscape is key. And there are many sources of information. There used to be, but there are now. There's the programme for government, the departmental statements of strategy, the individual sectoral strategies that many of you have alluded to. There's the public consultations. There's quite a lot there, which I think hadn't been available previously. The second point I always make when I talk to people is that the policy process is messy and it's complex. From the policymaker's perspective, it's about getting decisions made based on evidence and analysis, but time, budget, capability, political narrative, parliamentary arithmetic, amongst others, this all create a very complex process, and it can be very hard to navigate it. So from the policymaker's perspective, the more information they have, the more evidence, the better. From the individual researcher perspective, I think it's useful to frame research questions that respond to specific policy needs, and then work to submit the results and insight to policy practitioners to inform policy. And we've had 4 great examples this afternoon of how that's done. It really is important to build relationships and ground rules, I'm sure we'll come back to that, with policymakers over the longer term, and think how you want to position yourself in that conversation. And finally, I would always say reflect continuously as a researcher on those relationships. You know, so think, should you engage? How can you engage? Is it working? How do I build on that? So I think my time is just up. So thanks again for the invitation, and I look forward to continuing this important dialogue. Thank you. And I'm handing over to Fergal now.
Thanks very much indeed, Mary, and well done. Thank you for those very useful remarks. I think the seminar's aim was obviously to explore how we achieve policy relevant research from the perspective both of academics, researchers, and from policymakers. And I think we've heard 4 really excellent examples of how policy relevant research can have a highly practical input on policy development. And it's fantastic to see examples where we're not talking pure theory, and theory obviously has its place and is very important, but it's the practical impact that these case studies demonstrate. Connected but different in different ways. I mean, Charlotte's case study on activating social empathy, Colette's example on health behaviours in young people, Siobhan's on active sexual consent, Nata's on domestic violence. All of them resonated with me in terms of the links between identifying clear evidence and achieving very specific policy responses. So I think that these are hugely valuable in themselves for what they do. And it's great to say that across the university, there were many other examples as well that we could have picked. And these particular 4 ones that I suppose stood out to us as we were looking at who we might invite to take part. So sincere thanks to everybody involved. A couple of lessons and reflections from the case studies that struck me particularly, and then maybe a little bit from my own experience. But maybe the first 3 that really came through from the 4 presentations. The first one was the power of data. The second was the power of the message. And the third was framing the message. And I'll say a little bit about each of those. In terms of the power of the data, I think Siobhan's example of the extent of sexual harassment that is present or that young people are experiencing. I mean, 87% in higher education institutions of people reporting some degree of sexual harassment, 20% in the school system. Very, very significant indeed. Similarly, NATA's estimates of lifetime costs of domestic violence are a really practical example of an area where, as she noted herself, I think people would not have been conscious of the scope for or of the danger of that sort of cost arising in relation to an area which in itself is so extremely concerning. But 56 billion in the Irish case, or 2.7 billion per annum. And in terms of GDP loss, the example of 1% of GDP loss in Ethiopia, and no doubt similar amounts in other countries. So the power of the data that you can get across to policy practitioners, to ministers, to others making tough decisions, I think in itself is really, really valuable. In terms of the power of the message, again, if I may quote Nata's work, the analysis on the cost of doing nothing. And sometimes we forget completely in a policymaking sphere that cost of doing nothing. The implicit assumption that what we're doing at the moment must be better than anything else that we could do. That amounts to a cost of doing nothing, of not taking action. Similarly, I think Colette's discussion about making the message count underlines the power of the message, communicating it by sharing it, making it accessible. And interestingly, the point of not solely doing the academic pieces in the academic journals, important and all as that is, but also the fact sheets, the summaries, the case studies. I think the emphasis on plain English is just so important in that regard. And then the third element that I wanted to talk about, the framing of the message. Interestingly, domestic violence, for example, as an economic issue rather than solely extremely important as it is as a social issue. It reminds me, for example, of other messages that were framed in different ways to get them past the line. Many years ago, I was involved in the Department of Health in the area of the smoking ban in public places. And that initially, people may recall, was being seen as rightly as a health issue and a health and safety issue. But then it was reframed in the public mind as an issue relating to the safety of bar workers and others working in facilities where smoking was permitted. So reframing the message, framing and reframing is so important in that regard. Other thoughts then that come through from the presentations, the evidence-informed decisions and how possible they are when the evidence is properly marshalled and presented clearly. And we've saw 4 very good examples there, even in some instances in the case of unpopular or potentially unpopular decisions for government. When government is armed with the facts presented by good research, it really, really can make decisions that are either difficult, or even if they're not difficult, they could be simply decisions that wouldn't have been taken at all otherwise. So I think that's very important to emphasize that. The other thing that came through from Charlotte's presentation, for example, is the argument for co-design, for collaboration. Charlotte's example of student and teachers and involving young people was, I thought, really, really important. Colette's example of collaboration with the government department, she described it as a flagship cooperation and collaboration, which was equally striking. So it's the building of trust, the building of long-term relationships, and being prepared and able to broaden the dialogue from, if you like, the usual suspects, so to speak. So they were the things that really came through to me from the discussions. And before I finish, just a couple of other points that occurred to me as well, and would have been well reflected across the debate. I think the how is as important as the what. It's simply not enough to know that your research demonstrates that something should happen or should not happen, or that a particular policy option should be taken. It's how you get there. And again, the support that research and data can offer is very, very important in that regard. Clearly, that requires thought, it requires focus, and it requires maybe another part of the empathy that Charlotte was talking about earlier. Equally, being clear about the objectives from the very beginning and ensuring that they inform your thinking throughout, both at the research stage and at the policy development stage. And probably a statement of the obvious, but the policy feasibility and implementability, they must go hand in hand. There's no point in coming up with a policy that's not feasible and that's not implementable. And again, going back to the collaboration element makes that just so important. Finally, the thought that research for policy lives in a very challenging world. Research competes for attention across so many domains. It competes for policy space, it competes for policy analysis, it competes for resources. And as Mary has described, bringing the research to the attention of policy practitioners by providing them with good information in an accessible way is key. But equally, to reflect the optimism that Mary offered, there is cause for optimism, I think, in terms of what has been happening in recent times in the policy development space and the research space. I absolutely agree with Mary. We certainly don't have the architecture or all of the architecture at the moment that would maximize our ability to bring researchers and policy practitioners together. But at the same time, I think we have a good deal of the raw material that Mary has touched on. And clearly the challenge is to join up and scale that in a structured way. And we are, I think, heading in the right direction in terms of the DFERIS initiatives, the evidence for policy framework that will come shortly, the evidence for policy unit, the work being done under Impact 2030, and also Campus Engage's work under the Irish University Association on training, on brokerage, and so on. I think we live in a very exciting and interesting space at the moment in bringing policy makers and researchers together. And I hope that and I certainly believe that the practical examples of case studies here that have been put forward by the four presenters will underline the value and practicality of all of that. So that concludes my comments. I'm going to hand over now to Caroline McGregor, who has kindly agreed to moderate the Q&A session. So thanks very much.
Thanks very much, Fergal, and just to say thanks to all of the colleagues for such a stimulating and interesting discussion and presentation. And I suppose one of the comments we have in our Q&A is just to acknowledge how useful the session was, and people particularly valuing the inputs in terms of the pragmatic policy and community connection that the case studies have provided. I'm very glad this session is being recorded, because there's been so many excellent suggestions of practice, both kind of conceptual and practical, and I think that our audience will have got a great deal from it. I'm going to start with the general question and going to pose it to our four presenters. And while I'm doing that, just to encourage those listening, there is room. We have a few questions in, but we certainly have time to take a few more. So please do pop your questions into the chat, and I'll do my best to summarize them and pose them to the panel in the time that we have. So for Charlotte, Colette, Siobhan, and Nata, there's a kind of a general question that's been posed that maybe each of you can briefly speak to get us started. And it's really, you've talked a little bit about it, but how do you track your impact on policy? So maybe just you've all contributed, but maybe you can give us a little bit of advice for how we track and keep a record, I suppose, and are able to demonstrate that impact over time. So Charlotte, I'll go in the order of the speakers who might speak to that for us.
Yeah, that's great. So I actually think this is a really good question, but I think it's maybe a difficult one to answer. And I think, Colette, you've kind of touched on this a little bit in your presentation. I think how you track your actual policy impact for me is something I find quite difficult with our research. And then how do you know that, you know, it's your particular study that has impacted policy? Because I think, we should be aware that each research project that we're involved in is just one piece in the puzzle, and that there are other researchers that, are also kind of contributing to the story. So I think sometimes it is hard to see what the direct link is. I suppose maybe how we've tracked it is maybe a little bit more informal, and I'd be really interested to hear from other colleagues if there are maybe better ways of doing this. But I suppose it's the interest and the engagement we're getting from policymakers. When you're approached or contacted by policymakers, or you're invited to contribute to a conversation or the discussion or inform policy. I mean, that at least makes us at least informally aware of the fact that they're aware of our research and that they're considering our research. Whether that's the actual key part that informs their decision, I don't know. But at least it's a way of knowing that we're being invited to the table, that we're there as well. But I would be really interested to hear what kind of other colleagues think of that as well.
Thank you, Charlotte. What about you, Colette?
Yeah, so similar to what Charlotte said, I think it's a difficult, and we need to become better at it. Also because we need to demonstrate impact. So, that is being asked of us more and more. So, I mean, one of the things we do look at, where our work is cited in policy documents, it's only one way of looking at, how they have referred to our work. So we do, I suppose, capture that. That's sort of one way. Interestingly, I'm involved in the institutional review of research, and HBSE is one of the case studies. So I'm trying to write that impact case study, which is hard. And, the external sort of review is that it's not evident enough. Is this really impact? That's more outcomes. So it is a challenge. Other ways is we have reached out to policymakers looking for, their feedback on how have you used our data, and use those quotes and actually just start capturing them. I mean, we didn't do this many years ago, unfortunately, but starting to do that now and kind of recognizing that that does have, I suppose, importance, and, people do acknowledge and appreciate that and see it as valuable, I suppose. So while it is more of a qualitative measure, I still think it is important. And yeah, so they're probably, I'm trying to think of other ways. They're so yeah, and it's about trying to track it, I guess, but we don't have a sort of one mechanism that fits every project, particularly long-term projects. We collect data every 4 years, so it's a long time. And as whether it was Mary or Fergal saying, policy making can be messy, and governments change as well. So there's lots of shifts, isn't there, in this process. So if there's another way or another mechanism we could use, I'd love to hear it as well.
Thanks very much, Colette. That's actually really, really interesting and helpful. Nasha, do you want to add anything from your experience?
Yeah, I think actually Charlotte and Colette have highlighted some of the main ways that we try to track the impact of our research. The other is that we have worked closely with NGOs to see how much of the research begins to get integrated into their ask and demands with government. So it's not just policy impact. It's not just that a policy is changed by the government, but it's also how broadly this information is utilized by different actors. So that's one way that we engage with NGOs to see. The second is that like the data that I have produced, tracking to see how it appears on different, let's say IMF has a blog that they cite that data, or the UN Secretary General. So as Colette said, how is the information being used by influencers or policymakers is another way. And then, and then, as Colette said, also about getting requests, or I think Charlotte also said, getting requests, building on the work that you've done. Like now, the Ghanaian Prime Minister's office, the President's office, has come to us saying they want an update on the estimates that we've made. So again, they're seeing that, yes, this is an important piece of information that helps us to think about our macro planning. So it's, unfortunately, we don't have mechanisms, we don't have data as such that we can track, but we have to spread the, we have to go multiple different ways to try and collate the information that's needed.
Thank you, Nasha. And Siobhan, is there anything you want to add to that?
Yeah, just want to agree with everybody, but it's also how we make them aware of the data, how are we going to share that data? And it's about using all the different levels. It's, very few people read research reports, just saying. You know, we have to make the data available to policymakers, especially in ways that they will actually engage with them. So it's getting involved with every level. So, you know, if we talk to everybody, like Nata says, it's the broad use of the information, it's the broad use of the data that comes to the attention of our policymakers, because most policymakers are parents, are engaged in relationships, are aware of the issues that are out there. And it's about how do you engage with them? What do you make it interesting for them so they can say, well, okay, we could use the data, and then offer them a solution as to how we could change things to make it better for people going forward.
Well, that's very comprehensive. I hope that for the audience that gives lots of different ideas. It's not simple, but lots of different ideas about how that can be tracked. Colette, there was 2 early questions in that were maybe sort of informational questions, maybe that I'll pose both to you, and maybe you can just briefly point our colleagues in the right direction. One participant was very interested in your Making It Easier section and would like a small bit more information on the data app that you mentioned. And another colleague is making reference, as many of you may be familiar with, the online tools like Overton that sort of captures the referenced academic research and public policy, and was wondering, is your work referenced in the DCE DIY policy documents in this regard? So just 2 practical questions for you, please.
Yeah, so thanks. So in relation to the data app, so we do have a section on our website called Data Visuals first. So actually people can go in there and select different indicators or measures of child and adolescent health that they're interested in. And actually we have it for kind of trend data as well from 98 to, we'll say, well, it will be updated now for the 2022, and they can look at age, gender, social class. So it's a quick way for some people to go in and say, okay, what's the pattern looking like here? So that's, I suppose, data visual, some of the work we've been doing with that. And also a data app. So together with the World Health Organization, because they're a collaborator on our study, they do have an app that people can, you know, download and use. Again, similar to go in and say, okay, what's the picture looking like for X or Y? Now, do we know if policymakers use that? I can't say. I can't track necessarily, you know, who uses it. We can track things like downloads and things like that, you know, but I couldn't say specifically if policymakers use it. But it's just another mechanism, another medium, I suppose, through which people can look at data. In saying that, often the policymakers come to us to say, oh, can I say this or can I say that? You know, that again, it's about the messaging maybe, which was also mentioned here, what can be said or cannot be said, because just looking at the data visuals, it doesn't give you the full context, maybe, you know, even thinking data was collected just after COVID-19. So does that have a, you know, an influence on what the findings are telling us? In terms of Overton, I actually haven't used it. I am aware of it. One of the things we do put on our website, though, is where different strategies and reports have cited our work, both international and national. So yes, our work is in various different government documents. And obviously, I've already mentioned State of the Nations, etc. You know, we also wrote up a chapter about that whole youth participation and the flagship partnership with DCE DIY. Some of those aren't as easily to find, I suppose. But it is hard, and I think it takes time, and carving out time to do some of those things, and the tracking can be difficult as well.
Yeah,
I hope
great.
that's answered the question. Yeah,
absolutely. Time is one of the factors we keep coming back to in terms of being able to do this work. Thanks very much, Colette. The next question that's come up is, I might direct it to Fergal and Mary to start with, and then others might want to come in. A question about, what do you think, building on what you've talked about, are the main things the civil service could do to improve its links with the research community? So I don't know, Mary or Fergal, would one of you like to address that first?
Sure. Do you want me to come in first? Or,
yeah. Thank you very much.
Thanks indeed. Well, I suppose, and I think it's a very good question. One of the things we absolutely need to do is simply reach out. I think it does behove the civil service to reach out and actively invite researchers to speak at things, to contribute. We need to actively create and promote that dialogue. The other thing I think we need to do is perhaps push ourselves as policy practitioners in the shoes of researchers and try and understand the world that they're in. The worst thing we can do is start just shooting out invitations or requests for instant answers to tough research questions, and that's the simplistic stuff that still unfortunately tends to get done at times. Hopefully not too much of the time anymore. You know, please give us the answer to X, when in fact research is far more nuanced than that. So I think we can help by framing the questions in a better way, and also I think asking the researchers, the research community, to help us frame the question in a way that can actually produce a good answer. So I think that's really important. And finally, I think there's an element that I've been pushing quite strongly since I came to Galway, was a realization that outside direct people working in government departments, and mostly at the more senior level dealing with policy issues, people tend not to have a particularly good understanding of how policy gets made. How does a minister decide that he or she is going to take this issue and run with it and deal with it in a particular way? So I think one of the things we can do as civil servants or as policy practitioners is to offer some more information, both through websites and perhaps through workshops and discussions. How does policy actually get made? I mean, why should we assume that everybody else knows how policy gets made in the complex area of policy of government departments? And Mary was describing the policy process as messy and complex. I think we need to unpick that a little bit and make it as straightforward as we can, so that people have a better understanding of what they're dealing with.
Great. Thanks very much, Virgil. Mary, do you want to add anything to that?
Just a few things, because I think it's a really important question. And I'm always struck, in fact, Ireland being a very small country, my experience is that the dialogue between the policymaking system and the research system, with some notable exceptions, is very limited. And I think that is both a challenge and an opportunity. So what's the answer? Well, of course, I'm back to my normal place, which I think we need to pay attention to the architecture. So just taking it from the civil service side, which is what this question is about. So those of you who work with the Department of Children will know that they've had a research unit for a very long time, since the establishment of the Office of the Minister for Children almost 20 years ago. And that shows, and it shows in today's seminar, because they have built up a range of expertise, a range of relationships. They know who does what where, in a way that very many other departments don't. So part of the work that Fergal, Sean and I are involved in is to try and support that becoming the norm rather than the exception. So that's one thing I would say. I think that, like, I can't see how the research community can reach effectively into the policymaking community unless that happens in departments. So that was the first thing to say. The second thing is that the again, Department of Children, but again, some other departments have published research and data strategies. And I think that, again, without that, how can people see what the priorities are in research terms within the civil service? So the establishment of this interdepartmental research committee is, in my view, very important, because all departments are represented on it. And I understand that one of the things they will do is ask every department to publish a research and data strategy, and that would provide us with with a foundation. The third thing I would, given that I have the floor, I wanted to say two more things. So some of the issues that most bedevil us at the moment are cross-cutting issues, and we have been doing a little bit of work in climate action and it's a really challenging and interesting kind of set of issues, because there's a whole range of actors. And my sense, again, without being critical, is that things happen, but they're not joined up. So one of the challenges, I think, to everybody involved from the civil service side is to try to figure out what a much more joined up approach to dealing with these cross-cutting issues, using the resources we have in place much more strategically, what that would result in. And the final point that I make, which I think is highly relevant, is we need to think about how we build capacity in both directions, because this isn't going to work unless we strengthen our relationship. So that means having easier ways of academics working within the policy system, and to be honest, vice versa. I think there's tremendous exciting potential in that. But it's a medium-term set, which is worth starting to think about it at this stage as we move forward. So thanks for that.
Well, thanks very much, Mary. And you sort of lead into, there's a few questions. I'm conscious of the time, of course. It's like, you know, as we come near the end, we're getting more questions and answers. So I may not get to them all, but there's a theme coming across a few questions, colleagues, which sort of builds on what Mary's just talked about. It's from the other side, the independent researcher. So you've made it so clear about the motivation and the passion and the commitment and the time and the complexity in terms of achieving this type of engagement. But what about for an independent researcher who maybe doesn't have the lot of resources or who's on a short-term project? Would anybody like to give advice to that researcher in terms of a few pointers of how they can start to make those connections within those limitations? It's a difficult question, I know. Would anybody like to say anything about that?
I'll make an attempt because it is very difficult. Because obviously, independent researchers who are just on their own, doing small project work, do not have the access or actually even the time to be able to engage in this kind of conversations that are needed because they're already being driven for a particular output. But one, to find space within the project itself. So within that project hierarchy, trying to create some space, getting pointers and mentoring from the project PI of how to do this. I think that's very important. Second also is that, and this is something I wanted to say to Fergal and Mary, it's about that, you know, researchers should not be focusing on ministers. Researchers must be focusing on building the relationships with the civil service, because the civil service is what continues. Ministers change. So you have to work with trying to get connections into different departments with the third or fourth in command. And even independent researchers can begin to focus as they're doing their research, identifying that not the top level, but the third and the fourth level, and try to build relationships. That's my advice.
Thank you, Nasha. Anybody else want to add? We're coming close to finishing up our time, but any other pointers, just very briefly? Colette.
Yeah, just briefly to add to maybe Nasha's point, ideally, and I guess we've been trying to do this as researchers in institutions, that is part of your project or your proposal, that you've built in that knowledge translation piece. I suppose that's part of the whole project and it's not an add-on. I mean, the other thing just to add about capacity building, so because of, I suppose, of our interest in knowledge translation and use of knowledge, you know, in whether it's policymaking or practice, we have developed a module on knowledge translation in health and social care. So we've rolled that out across the institution, and so students use that. Now, these are postgraduate students, but again, it's linked to the kind of capacity building, so that, you know, they are recognizing from an early stage of their own research, okay, what am I going to do with this when I have my maybe 3 papers published? And they have a knowledge translation strategy and plan and a way to evaluate it as well. And it kind of comes back to, how do we know if we've been effective or not? So just to flag that as well, that we're, I suppose, thinking about those things.
That's really, really helpful. And Fergal, you mentioned, and a few people have the term of framing. And I suppose that's another, you know, that even without having the resources, you know, that we can always think about how we frame the issue from the very start. Thanks everybody for your other questions. I'm not going to be able to pose them, but just to give the audience a flavour, some really interesting comments and questions about how you can bring together so many different really interesting studies on kind of lived experience in different contexts, and whether there is a need to sort of maybe have a more central communication approach in terms of learning across our projects. Somebody's asking, are policy briefs of any use anymore? Something for you to think about. A colleague is suggesting we think about impact not just in terms of outcome, but also process oriented, that maybe we need to think about impact in that way. And thank you. A few other colleagues are sending some really interesting information, which we'll be able to capture here and we can put into the chat or the notes to finish. So can I just say thank you very, very much to the audience for your really interesting questions. And thanks very much to my colleagues for responding to them. And now I'm going to hand over to Fergal, who's going to close the event.
Thanks very much indeed, Caroline. Very much appreciated. Look, I think it's been a very interesting and thought-provoking seminar. I think it's been very practical in demonstrating how research can have impact, and we've had a really, really good discussion. Just to repeat, John's sincere thanks to our speakers, Dr. Charlotte Silk, Professor Colette Kelly, Dr. Siobhan O'Higgins, Dr. Nata Duverry, and particular thanks to Mary Doyle, my colleague, for joining me in offering reflections from a policy perspective, and also to Professor Caroline McGregor for moderating the Q&A session so effectively as usual. Huge thanks, if I may, to Professor John Canavan for introducing the session, for keeping us all on track, but more widely for his invaluable support and advice throughout the process, and also to Kieran Walsh in that regard. And last but not least, to repeat John's thanks to Gillian Brown and Deirdre Conway for their usual excellent support on logistics. It simply wouldn't operate without you. Just before I close, I'd like just to say a little word about the last seminar in this series, which is happening on the 28th of May. It's a significant in-person event, we hope. It poses a question about what next for Irish public policy development. It'll take place, as I say, on Tuesday, the 28th of May in the ILAS Centre in Galway. It'll be a collaboration involving the Senior Civil Service and the University of Galway. We've invited 3 Secretary General speakers, as well as an eminent contributor from the Blavatnik School of Government. Save the date is just coming up on your screen there, and it's going to issue very shortly indeed. I think it'll be an interesting and valuable session, which will bring the current seminar series to a close. So I'd encourage you to put it in your diaries for Tuesday the 28th of May, and as I say, it'll be in person. So look, it only remains for me to thank you all, to all of you who attended. Thank you for participating, thank you for your questions, and also to confirm that a recorded version of this will be available shortly. So thank you very much indeed to everybody, and good afternoon.